My name is Joanne Anderson. I'm one of the Mesothelioma UK clinical nurse specialists working at South Tyneside and Sunderland NHS Foundation Trust. In this video, I'm going to talk about the diagnosis and treatment of mesothelioma. Mesothelioma is a type of cancer that can affect the mesothelium. This is the thin membrane that lines the inner surface of the chest wall surrounding the lungs, known as the pleura, or the inner surface of the abdomen, known as the peritoneum. It is more common to have mesothelioma affecting the pleura. Developing mesothelioma is associated with a history of coming into contact with asbestos and does not usually develop until many years after the exposure has occurred. Symptoms of mesothelioma can be vague and include chest pain, shortness of breath. This may be caused by a build-up of fluid known as a pleural effusion in the space between the two layers of the pleura. Cough, sweating, loss of appetite and weight loss, fatigue and general tiredness. There are different tests that help doctors to diagnose mesothelioma. Your first investigation will often be a chest X-ray, which may have been arranged by your GP. Once an abnormality has been detected, you will be referred to a specialist at the hospital for more detailed investigations. All patients with suspected mesothelioma will undergo a CT scan to create a three-dimensional image of the inside of your body to show the size and position of the suspected cancer. This scan will help the doctors decide on the most appropriate way to get a sample or biopsy to confirm the diagnosis. Investigations to confirm a diagnosis of mesothelioma will require either taking a sample of the fluid around your lungs or more preferably a biopsy from the pleura. This can be done in several ways. Pleural aspiration. Under local anaesthetic, a needle or small tube is inserted into the fluid around your lung using an ultrasound scan. This is usually carried out as a day case, but if there is a lot of fluid, the doctor may recommend a short stay in hospital. This can be performed at either Sunderland or South Tyneside hospitals. Thoracoscopy. This is an examination of the pleural cavity with a special camera. This allows any fluid to be drained and biopsies to be taken of the pleura. Depending on your individual case, this may be performed under local anaesthetic at South Tyneside Hospital or under general anaesthetic at the Freeman Hospital in Newcastle. In both cases, this will involve a short stay in hospital. CT guided biopsy. This involves passing a fine needle under local anaesthetic into the abnormal area of the pleura. The CT scan is used to guide the needle into the correct position to allow the biopsy to be taken. This procedure is performed as a day case at both South Tyneside and Sunderland hospitals. Once all the investigations are complete, your case will be discussed by a multidisciplinary team or MDT. This is a team of doctors and nurses with expertise in mesothelioma. The MDT will look at all your investigations and, taking into account the size and position of the cancer, along with other factors including your general health and other illnesses, before deciding on the most appropriate treatment for you. Following the MDT discussion, you will be invited back to the clinic by your consultant to discuss your diagnosis and options for treatment. If you have not already met a clinical nurse specialist, you will be introduced at this point. They will be able to offer support and information on all aspects of your care. Treatment for mesothelioma. Chemotherapy. This is the most common form of treatment for mesothelioma and uses anti-cancer drugs to kill the cancer cells and slow the growth of the mesothelioma. This is usually given by intravenous infusion or drip into a vein in your arm. You will be referred to an oncologist who will supervise your treatment. Chemotherapy is given as a day case and can be given at both Sunderland and South Tyneside hospitals, as well as the Washington Primary Care Centre. Radiotherapy. This is the use of high-energy X-rays targeted at a specific area to destroy cancer cells. In mesothelioma, radiotherapy is used mainly to help relieve specific symptoms such as pain. You will be referred to an oncologist who will supervise your treatment, and the radiotherapy is given as a day case at the Freeman Hospital. Surgery. For mesothelioma, surgery is only appropriate for a very small number of patients with an early diagnosis of mesothelioma. Surgery is undertaken by a cardiothoracic surgeon and has previously only been used in clinical trials. Not all hospitals offer surgery, and you may need to travel to a hospital out of your area. Active monitoring. If you do not have any significant symptoms at the time of diagnosis, the MDT may recommend this approach. No active treatment is given immediately, and you are monitored closely by your consultant and clinical nurse specialist. Options for treatment will be discussed as and when symptoms arise. Clinical trials. This is a way of finding out if new treatments for mesothelioma are better than the current best practice and may relate to any of the treatments I have mentioned today. Getting onto a clinical trial is based on you meeting a strict set of criteria. While receiving treatment, you will be under the care of a research team, and your treatment will be supervised by an oncologist. While some clinical trials can be offered locally at Sunderland and South Tyneside hospitals, some will involve travelling to the Sir Bobby Robson unit at the Freeman Hospital. If you would like more information on clinical trials, you can speak to your oncologist or clinical nurse specialist. Supportive care or palliative care. For some people with mesothelioma, they may not be suitable for active treatment due to their general health or other illnesses. The aim of this type of treatment is to provide relief from symptoms and help you live as actively as possible. This will involve healthcare professionals, both in the hospital, including your consultant and clinical nurse specialist, as well as in the community through your GP and district nurse. Depending on symptoms, it may also be recommended that you are referred to a specialist palliative care team. Compensation and benefits. Mesothelioma, due to its link with asbestos exposure, means that it is classed as an industrial disease, and you may be eligible for specific benefits and compensation. Your clinical nurse specialist will discuss this with you once a diagnosis has been confirmed, and will recommend referral to a specialist welfare benefits advisor for more information. If you have any concerns about this video, please contact your clinical nurse specialist.